So I'm currently a PhD student at the Institute for Musculoskeletal Health. And just before I started my PhD, I actually had a physiotherapy by background, and I have experiences working in both private practice and the aged care facilities. Current project, which is a sure step mobility program that aims to improve the mobility of the inpatients in hospitals. And so the initial study that we've done with the sure step program has found that there is actually a lot of benefits in doing a group circuit standing exercise. Standing exercise class, and it was found to improve the balance and mobility of the inpatients, as well as reducing the readmissions and length of stay. And most importantly is that it saves money. So that's why we are now thinking if this program can actually be implemented into other new hospital settings. And within our project, we are targeting two new hospital sites, the St. George Private Hospitals and Prince of Wales Hospitals. So what we are trying to really do at the first stage is to work with the different health professionals locally at the hospital site and the patients there to understand what works and what does not work for the program to be run more successfully. And so we do anticipate that there will be some changes required in order to suit the specific context, but we do emphasize that there are some core components within the exercise program that we need to maintain. For example, the type of exercise, it needs to be a balanced exercise because that's the idea. We want to improve someone's balance. We need to challenge their postural control, their ability to shift their weight. So these are important components that we need to include. We also need to make sure that the exercise itself is challenging enough to the patients, although there may not be a fixed dosage, but then we need to come up with ways that we can measure whether or not the patients feel that the exercise is challenging for them so that they are progressing, and the exercise itself will cause some additional benefits. We don't have a specific criteria for the patients because that's actually one of the essential components that we want to include to make sure that the research it can be translated into the real situations, because we want to make sure that the program is suitable for a wide variety of patients. But we do have a broader criteria. For example, patients with a wide variety of age range, with diverse cultural backgrounds, with different lengths of stays in hospital, with different clinical conditions, because in that case, if we are able to suit a wide variety of patients, then it is more easily to be rolled out to hospital sites with different clinical settings. So I think there are two main key findings that we expect from this research. The first one is we really want to know what works and what does not work in order for that program to be successfully run in the two new hospital sites. And the second thing is that hopefully once we know what works and what does not work in stage one, then the program will be more easily or more successfully being run in the real world practice. And we will expect that the program itself will also be effective in improving the patient outcomes and hospital outcomes. For example, improving the balance, mobility, as well as reducing readmissions and length of stay of the patients. And hopefully, again, by reducing the readmissions, we can reduce the hospital costs and hospital burden in general. It's a further goal of doing this research is to come up with a roadmap that we can provide to our future clinicians or researchers to then try to really incorporate this mobility program or other similar evidence-based mobility program into their routine practice. And it's therefore not just limited to St. George Private Hospitals or Prince of Wales hospitals, but hopefully we can then, if it is successful, we can roll it out to more hospital sites and to incorporate that into their routine practice according to their own hospital policies. By including both private and public hospitals, we will anticipate that there will be some differences. For example, there will be differences in their hospital systems, and therefore the adaptations required will be different. And because our ultimate goal is to provide a roadmap to more hospital sites, and that will definitely include both private and hospitals. And therefore, if we can then come up with an adaptation framework that is for public and private respectively, then it will then benefit or cover all the different hospital systems across Australia, and to benefit more inpatients across our country. And I think first of all, I was very fortunate to get involved in this research, because I think it's really a good opportunity to allow me to bridge the gap between evidence-based practice into a real-world situations. And I guess we have a lot of evidence-based practice nowadays, particularly in the area of physical activity. However, a lot of evidence may actually be underutilized because we didn't actually input that into practice. And I was really fortunate that I got this opportunity to not only investigate the effectiveness of this mobility program, but we really have a chance to try and implement and make sure that what we find from the research can be translated into the practice to help people in the community.